free counseling services to children and their families to help them talk through their diagnosis and work through the emotional and behavioral concerns that have arisen since families have been diagnosed. And so next slide. Just a little bit about Annie's Place in case if you're not able to come to our presentation on Thursday. The main purpose of Mommies in Need is to provide care for kids so families can access health care. We believe that parents should never have to choose between taking care of their own health and having safe and loving care for their children. This was born out of one mom's experience and passion and has grown into a powerful source of hope in our community. Since our inception in 2014, we have provided tens of thousands of hours of free childcare to people in the Dallas community. If you're interested in receiving services at Annie's Place, you can visit our website at mommiesinneed.org. Go ahead to the next slide. A couple of the things that we offer here at Mommies in Need, we provide free childcare to families who are seeking any medical services. And so we're located right next to Parkland's main campus at 2131 Butler Street. We also provide free play therapy for families experiencing a medical crisis. And so we serve lots of families who have just found out that they received a breast cancer diagnosis, and parents who are not quite sure how to talk to their children about that, or their children are experiencing some new anxiety about, is mom going to be okay? Is she going to come home from the hospital? Or new aggression, like mom's not able to provide enough support to me now that she's taking care of herself. And so we're able to provide free play therapy counseling for children here at Mommies in Need. We also have an in-home nanny program for families who are going through a medical crisis. And so if you are going through a medical crisis and you are on bed rest or you're not able to hold your children, we can send a nanny into your home and provide that service. And then finally, we have our virtual nanny program, which we can serve anyone across the United States. We send you art supplies and activities for your kid. And so if you've just had a chemo appointment and you're feeling extra tired, need an extra nap for that day, we can send in a virtual nanny via Zoom to watch your child while you get some much needed rest, or maybe do the laundry, something like that. So that's just a little bit about Mommies in Need, where I work here. And now we'll go ahead and get started about how to talk to your family about your diagnosis. So before you even begin, as you prepare to talk to others about your diagnosis, it's a good idea to determine how you feel about it. There isn't one right way to feel about it. You may be shocked, you may be angry, numb, scared. There's a number of feelings that may come up for you whenever you first find out about your diagnosis. Once you know how you feel, then you'll be in a better position to let your friends and family know how they can help you, because that's going to be one of the first questions they ask: how can I help? Recognizing that you're going to have a lot of new feelings come up, some degree of depression and anxiety is common in people who are coping with cancer, which Kendall is going to talk a little bit more about anxiety for the next presentation. It's not uncommon for people who learn that they have cancer to go through a period of shock, disbelief, isolation, avoidance, or even denial. And so for many, understanding what to expect and gaining more knowledge can really help make things easier to move forward. And so just make sure that you're checking in with yourself and your own feelings before you start talking to other people about your diagnosis. And if you are having really heavy feelings that you feel like you're not able to cope with, please seek out counseling services and discuss those with your oncology team. Next slide, please. So before you begin to sit down and tell somebody about your diagnosis, let the person that you're speaking with know that you need to speak with them about something very important and that you'll need their undivided attention. Ask them to make sure that it's a good time to talk about something and make sure they're able to hear what you have to say. Unlike this picture right here, make sure they're not playing on their cell phone, not able to fully absorb what you're talking about, because it's something really important that you're about to share with them. So why do we need to speak with the adults in our lives about our diagnoses? First, to gain emotional support. It's really important to have a support system whenever you're going through a breast cancer diagnosis. Also to gain physical support. And so how you're able to physically interact in this world may shift with your new diagnosis. And so gaining the physical help that you may need. Also to increase the people that you can rely on in times of crisis. You may experience a variety of ups and downs after receiving a diagnosis. And so increasing that support system is really important. And research suggests that having a good support system during treatment can be extremely helpful and even improve cancer outcomes. And so that's why we want to share with the adults in our lives what we're going through. So we're not isolated. Isolation can lead to even greater health concerns, both mental health and physical health. By internalizing your own concerns about your diagnosis, and not sharing your diagnosis with someone you can trust, you can actually exacerbate the symptoms of your mental and physical health. And so support is really vital for recovery and overall wellness, and so that's why we're sharing with the people in our lives our breast cancer diagnosis. Patients who have good social support system tend to have better outcomes, and so it's really important to share with as many adults that you feel safe sharing with in your life. Next slide. But there's more than just adults in your lives. Many, many people have children who it is necessary to tell about their diagnosis. So why do we speak with the children in our lives about our diagnosis? Because kids are really, really great observers. They will notice that something is going on different with their parents and that things are different at home. But children's cognitive development and inability for logical deduction of action consequences, children may attribute your diagnosis to something completely illogical. This may mean that a kid might believe mom is sick because of me, or mom is sick because I didn't eat my broccoli last night. Even though we may laugh whenever we hear those messages, children draw these conclusions unless specifically talked to about your diagnosis. So this is why it's so important to talk to your kids about your diagnosis so they don't blame themselves, their siblings, others, or anything illogical for why you are sick. Next slide, thank you. So who should be involved in the conversations that you're having about your diagnosis? The whole family should be involved if possible. That way that everyone's on the same page and one sibling doesn't tell another sibling something that they have misunderstood from what you told them one-on-one. Make sure that you have your spouse or your partner involved in the conversation so they can show the children that everyone's on the same page, and your partner can help support you if the challenging questions arise, and a lot of emotions may arise. Next slide, please. So when should you tell people about your diagnosis? The sooner, the better. As mentioned before, children will pick up on differences in the home and with mom right away, but soon doesn't mean when you are dysregulated. You should only talk to your kids about your diagnosis when you're able to stay regulated during the discussion, when you have your feelings figured out and you're able to be regulated for your children. This means to talk to your spouse or a close friend about the diagnosis first. Get the tears, the anger, the anxiety all on the table so you can present the info to your kids in a calm and neutral manner. It's okay for your kids to see all of those feelings because they probably will throughout your diagnosis and your medical treatments, waiting for news, or having hard days. But the very first time that you tell your kids about your diagnosis, they will probably have a lot of feelings of their own coming up and a lot of questions. So it's best for you to feel at a place yourself that you can hold and accept all of those kids' feelings that are arising without feeling overwhelmed by your own feelings as well. So making sure you feel really regulated before you talk to them. Remember to tell your kids when you yourself have the capacity for feelings and reactions, so not right after any chemo treatments when you're wiped out, or right after you have a cry because you've just had one of those horrible days Make sure you schedule a time. You don't want to drop the news at your niece's birthday party or some event that's coming up, but make sure that everyone has the time and is able to focus on the news and only the news that you're sharing. And lastly, remember that you don't have to tell people until you're ready. Ultimately, it's your choice when you're ready to share with the different people in your life. So when you do share, just be prepared that children are going to have their own emotional reactions. Adults in your lives are going to have their own emotional reactions. People will have feelings that come up whenever they hear the news. And so make sure that you're regulated when you're speaking with your children. You don't have to be regulated when you're talking with your spouse or your best friend, but it is better whenever you're speaking with your children to be able to handle those emotional reactions from your support system. If possible, have someone that already knows the news that you've shared before be there with you to help support you through telling your children. No matter the age of the person, the news may be scary and bring up a lot of emotions. This is totally normal. You can ask them what they know about what's happening with their parent, what questions they have, and what are some of the fears and thoughts that they may have. Don't be surprised if children's thoughts are very self-centered. It's very normal, particularly for younger children. They want to understand how your diagnosis will affect them. So be honest in answering those questions. Maybe it will be harder to spend time with the family, but assure them that you're going to do your best to continue to support the family. So what should you share? Decide ahead of time what information you'd like to share with the different members of your support system. With your partner or spouse, share as much as often as you can. They are there to be your #1 support person besides your oncology team. So share as much as you can, as often as you can, to get that necessary social support from them. With your friends and coworkers, share what you're comfortable with. With support groups, share your emotions and experiences. And then with children, be clear, be kid-friendly, and be honest. And ultimately, you get to decide how much you're willing to share with the people in your life. So what to share with your children specifically? Be clear, be kid-friendly, and be honest. So kids don't need to know about percentiles or specific labels, but they do need to know what they can expect. So for example, go ahead to the next slide. One way that you can tell your child is, Mommy is sick. I've been diagnosed with breast cancer. These are my breasts, and there is a disease in them trying to hurt the rest of my body. Mommy will be going to the hospital every day for the next 10 weeks, and then on October 3rd, Mommy will go to the hospital to have her breasts removed. This means the doctor will take Mommy's breast away because they're hurting Mommy's body. This is not your fault, and it is not Mommy's fault. When Mommy is in the hospital, Grandma Ruth will be coming here to stay with you for 1 week. And when Mommy gets out of the hospital, I will be very tired, and I'll need to sleep and rest for 3 weeks so my body can get better. You can read with Mommy and watch Daniel Tiger with Mommy, but Mommy won't be able to run outside and play with you or pick you up for those 3 weeks. Do you have any questions? So you can see how that's very kid-friendly, very clear. You have a plan set out and you share it with the child because their questions are all going to be like, how does this affect me? So that's one way that you can tell your children about your diagnosis. So how? In summary, make sure that you ask for undivided attention from the people that you're speaking with. Be regulated in your own emotions if you're sharing with your children. Talk early and often to your support system. They are there, and as research shows, the more support that you get, the better health outcomes you'll have, mental health and physical health. Be clear and be honest with everyone in your support system, and ask for what you need. Ask for that support. So, practicing. Whenever you share your health news, you may feel more comfortable practicing what you're going to say first. Find a trusted friend or a partner or someone from your support group who you can practice what you plan to stay with. You can work out the kinks and note different places in which you may become emotional, some hard parts in talking through your diagnosis, and may ask for support during that time. So being prepared is really beneficial, especially when talking to your children about your diagnosis. Make sure that you have ongoing conversations with your entire support system. Keep the people in your life up to date about how things have changed, how you feel, where you need support, and keep talking about your diagnosis often. Everyone in your support system wants to be there for you and wants to know how things have changed. The first time you talk about your diagnosis, you may feel shock or anxiety, and then later down the road, you may feel angry that this is happening to you. Make sure you're having ongoing conversations with your support system, that, especially when your feelings change. Next slide, please. So, recruit others for your children and for yourself. Enlist help from extended family, friends, community, maybe church support, to take turns with things like babysitting or maybe taking the kids to special events. It's really important to help your children maintain as much normalcy in their life despite this massive disruption and changes that are posed by a diagnosis. This is where extra people can really help you get your kids to a band concert or soccer practice. Be sure to talk with your children's school and their teachers about what's happening. Teachers are also very savvy about subtle behavioral changes or performance changes that your children may be going through that occur due to a family member's diagnosis. And so if you're willing to share with the children's teachers, be open as much as you can about what's been going on at home so they can also support your child at school. And then be thinking about what kind of concrete help that you will need. For instance, child care, shopping, meal prep, housekeeping, just to name a few things that you may need help with. People want to know what they can do for you and for your family, and make sure to remember to take time for yourself too, even if it's just 30 minutes to take a walk or a bath, or look at a magazine, or just take some deep breaths. Yeah, just ask for that concrete help, even if it's just taking a break for yourself. So, what if you guys need support in talking with your family? Here, you can always check in with me, our counselor here, but we have another play therapist about all the feelings that you've been coming up for yourself or your family. We can schedule a time for you to come in together so I can support you and talk through your diagnosis if you need a hand in how do I talk to my child, they're this age, or I'm worried about this certain thing. Here at Mommies in Need, we're here to help you. We are a Parkland partner, and we're happy for you to come in and talk with someone on our staff about how to talk to your family about your diagnosis. Additionally, your physician, of course, may have resources for you. Just ask your medical team for help. A social worker, child life specialist, counselor, or other team member may be able to support you in having those tough conversations and knowing what to say. It's also vital to join a support group, to have as much support as you can in talking to others who have gone through something similar. And just a little note at the bottom, if you need additional support, please feel free to reach out to me or my team here at Mommies in Need. And my phone number is there at the bottom, 214-266-8065, if you need additional support in how to talk about your diagnosis. Just a couple of additional resources for you if you are looking to join a support group or need help in the words to say to talk about your cancer diagnosis or your breast health in general. And make sure to reach out to your oncology social worker if you do need additional support. And yep, that's all I have for today. So thank you guys.
Thank you Dr. Weeks. So next up we have Kendall Sharp, MPH clinical psychology student at UT Southwestern, Oncology Behavioral Health, and she will be talking about anxiety in cancer treatment. Kendall?
All right, thank you. I'm Kendall. I use she, her pronouns. And today I'm going to be, again, discussing about anxiety within cancer treatment, kind of specifically talking about ways we can help to manage anxiety within cancer treatment. Again, I'm in Oncology Behavioral Health here at Parkland, and I'm supervised by Dr. Owasoba, who's the psychologist for Oncology Behavioral Health. So this presentation is going to center around what we call scanxiety, or just anxiety reported from going through the cancer journey. So about 10% of cancer patients will report a significant anxiety at some point during their cancer journey. And so that could be, when they first get diagnosed, going through treatment, or during maybe waiting to go into a remission period. So a big reported anxiety factor for patients is kind of surrounding cancer scans and staging. So this really can center around being fearful of the results, and what those results can mean, in terms of treatment, treatment options, or just kind of course and prognosis, as well as there can be fear of the scan itself. So, some of the machines can make us feel claustrophobic or, scared of being in tight spaces. And then there's also just this conditioned anxiety response around medical appointments and procedures. And so we know our patients have to go through so many appointments and medical procedures, but just even coming to our building or being seen for a medical appointment can just cause a lot of anxiety. So again, it's definitely very common with our patients, and something that we, are trying to reduce so that we can help you have a better experience. So I'm going to talk a little bit today about conditioning. So basically, when I was talking about the conditioned anxiety response earlier, we can be conditioned or taught to have a certain response. And so our kind of psychology classic example of this is Pavlov's dogs. So classical conditioning is just learning that occurs at an unconscious level. So we're not knowing that we're pairing these responses, but these things happen. So with Pavlov, where we kind of first saw this is he was feeding dogs, and he would pair that by ringing a bell, so a very neutral stimulus. And because the dogs were being fed, they would salivate. And so he kind of paired this stimulus with feeding and the bell. Over time, if they rang the bell, the dogs would begin to salivate because they had associated that sound with being fed. So even without the food being present, the dogs would salivate. So it can still achieve that same result. So that's kind of what conditioning is, and we see this obviously in humans as well. So I'll talk about how this applies to our patients here on the next slide. So for our patients, kind of in the context of scanxiety and getting a scan. So if you go in for a scan, maybe this is, the first scan you're having, you could get poor results, or just learning that you have cancer can be very anxiety producing and a very emotional experience. So again, that can lead us to feeling anxious. And so even if our results are okay, that initial kind of procedure and condition can lead us to feeling anxious. So we've seen that patients can either avoid getting repeat scans, or they don't want to learn about the stage of their cancer or going for those appointments because they're anxious about having poor or difficult results. And so we can kind of see that this is, super important for us as mental health providers to consider, so that we can get our patients adequate care and we can help reduce that anxiety. Next slide. So the very important thing about conditioning is anything that we learn, we can unlearn. And so, if you have this learned, response of being fearful of medical appointments, scans, all of that, we can work through that in a process we call extinction or exposure therapy. So basically, if we continually present the event, or, if we keep going to our medical appointments and nothing bad happens, eventually our feelings of anxiety will diminish and reduce. And so the goal is to unlearn that kind of feared behavior. And so ways that we can think about that and manage it we'll target anxious thoughts surrounding the event. So we can talk about kind of visualizing the event of going to get a scan or going to an appointment, talk about what kind of thoughts you're having, maybe patterns around it, identify points where maybe your anxiety is at the highest point, and kind of work through that step by step so we can prepare you for these procedures. And we can also work by teaching some coping skills to manage anxiety during any scans or procedures that you're having. So if that's, preparing, as I said, and kind of walking through that appointment and visualizing it, any kind of deep breathing, and things like that, to really kind of manage the anxiety, stay in the present moment, and we're able to get you through these procedures and these scans. So that's where our office kind of comes in. So in oncology behavioral health, we offer a variety of services to help our patients who are, dealing with some mental health concerns because of their cancer diagnosis. And so our office, we mainly do individual psychotherapy. So that just means coming in for a therapy session. So we can help you learn some new coping skills to manage your anxiety. So we teach progressive muscle relaxation, which can help reduce tension in your body, and again, kind of pull you back to the present moment and be very mindful about any kind of bodily sensations that you're feeling. Paired with that, we can also do any mindfulness, so things kind of like meditation, again, to kind of pull us back to the present moment, because anxiety is generally very future-oriented. So anything we can do to pull us back to the present moment, we found can be helpful. And then similar to that, there's also things called grounding techniques. So again, if you're experiencing a lot of anxiety, teaching you some skills to help bring you back to the present moment. In addition, we also do things like cognitive behavior therapy, acceptance and commitment therapy. So those are things kind of looking at your thoughts and your behaviors, and if there's a way that we can work through that to reduce some anxiety or depression. And we also just do supportive therapy. So we found that it can be very helpful to just have a place to talk about your cancer journey and talk about, things you're going through, because other people in your life may not understand. So just having a supportive space has been helpful for a lot of our patients. Particularly for breast cancer survivors, we are starting a new series of support groups. It's actually starting this week. And our group is going to be talking about body image because we found for breast cancer patients, this is a really big symptom area that is often kind of overlooked during a lot of medical appointments. So particularly if you've had any kind of surgery or have side effects like lymphedema, hair loss, things like that that can really impact our body image satisfaction. We found that for breast cancer patients, this is a kind of area of need, and so we've created a series of groups that I will actually be facilitating, where we'll talk about body image and ways that breast cancer and treatment have impacted body image, and then we'll teach some of those coping skills I've talked about earlier. So progressive muscle relaxation, some, thinking about our thought patterns, and doing a little bit of meditation. And then it's a group, so it also has a nice social component of being able to talk with other patients about their experiences and can kind of help you feel less alone in these body image issues. So very excited for that to get started. And our group is also looking to start more groups in the future because we know support groups can be very helpful for patients. And then also within behavioral health, we do have a psychiatrist just for oncology who, if you're interested in medication for any mental health concerns, that's available as well. So we do a lot and we love to support our patients. So definitely if you're interested, we have a lot of different ways to provide you additional support. Next slide. Great. So if you are interested in any of our behavioral health services, so this can be for patients currently undergoing treatment, or if people are in remission and still dealing with, anxiety or depression symptoms, you can definitely contact our office. You can ask your medical provider to send a referral to us, and we'd love to see you and help get you, your emotional and your mental health feeling better. Great, thank you.
Thank you, Kendall. So we have a few questions that I'm going to ask, and either of you feel free to join in, whoever wants to answer. So the first one is, how do I talk to my family about the approach I have decided to take in relation to my treatment?
So I think that depends on how you feel about their approach. Make sure that you feel comfortable in the decision that you've made and work through the feelings that come up whenever thinking about that approach. And then be clear with your family, give details to your partner, to the adults in your family, and then give your children less specific information about that approach, but be clear about what that means for them. And so if you're going to be ending your, I'm not sure what the approach is that you're choosing, but maybe chemo. So you're going to be going to the hospital every day. It will mean that you're very tired, that your body's changing. Share what that may look like for you and for your family. Give as much information about the decision and be confident in the decision that you've made.
Okay, just a follow-up to that. Yeah. So how would you talk to your children possibly if you didn't choose either chemo or radiation or something like that? Maybe you chose something holistically.
Yeah, and so you can just explain that I have decided along with my doctors that this is the best approach for me. It's going to look like this, so I won't be going to the hospital every day. I am going to be going to do more meditation. I'm going to be taking these different medications that's more of a holistic treatment. and being confident in that decision will help you be confident in communicating that with your children.
Okay. How would you, how do I tell my family that I'm not really looking for their advice on my treatment, my medication, my food, but I do want their support, but not necessarily their advice?
Say that. Say exactly what you're saying. Start the conversation with, I am going to be telling you about my diagnosis, and I've already made the decisions that are best for me with my doctor, and so I'm not really looking for advice, but I do really need your support, and share it as clearly as that so they know right off from the bat that you don't want to have your mind changed about what if you should do chemo or radiation, or if you should do more holistic medicine, but that you do need their emotional support, because this is going to be very difficult, and you do need their physical support in helping with childcare, helping with transportation. Just be clear, you don't want their advice from the beginning.
Yeah, and that's definitely something I think that we've seen in therapy, is just setting clear boundaries with, you know, your loved ones and people in your life that, you know, if you're just upfront saying, I just need emotional support, you know, I have my medical team that's helping me manage everything else. But yeah, just setting boundaries that, you know, you're just looking for emotional support, and that's something, you know, that kind of as Dr. Week said, practicing and talking with somebody can kind of help you, because those conversations can be difficult.
Okay. How do I talk to my family if my prognosis is not good?
That is where the oncology behavioral health team can really step in and help. You can go ahead and get some individual psychotherapy to work through the emotions that are coming up for you, but you do need to be honest about what is going to happen for you. And so gaining as much support from your support system, but also gaining support from the oncology behavioral health, and how do I handle my own emotions that are coming up when my prognosis is not good.
Yeah, that's definitely something that, you know, we talk a lot about with our patients who are maybe in a later stage or have a poorer prognosis is, you know, people may be at different stages of acceptance around that, and trying to manage, you know, telling people things that come up with that. But definitely individual psychotherapy can be very helpful, again, to work through your emotions and how you feel about that, and then can help, you know, prepare for how you have that conversation with other people in your life, and making sure that it's something that you feel is right for you, and is kind of aligned with your values. And definitely that's something that comes up for us a lot, and we like to make sure that we're here to support you in any of those stages.
Is there just a caveat to that? So you talked about individual counseling. Would there be counseling for either with your children or with your spouse or partner that you can have during treatment?
We currently only do individual psychotherapy here for behavioral health, but that is something that, you know, people have expressed interest in, and we can refer out to other providers in the community if that's something that people are interested in. But currently we're just seeing the patients.
So here at Mommies in Need, we do see families. Our focus is on providing support for the entire family, and so we typically see children in individual or group play sessions, but we do family sessions here at Mommies in Need, which is a free service partnered with Parkland Hospital, but we don't do couples therapy, and so we would also refer out for that service.
Okay, I have one last question. Can anxiety or stress cause physical symptoms?
Yes, for sure. And so, that's how a lot of people will come to us and say, I have a lot of headaches, I have a lot of tension in my body and my joints, and I'm tired, and all of these things, because anxiety does typically present as physical symptoms. And so that's something that, we work on a lot in therapy, is teaching ways to identify when we're having those bodily sensations and ways to cope with that. So if that's doing progressive muscle relaxation to help with any tension that's stored in your body, and then kind of also working through those anxiety thoughts, because they're very often related, and it's very common to have physical symptoms with anxiety.
Okay, that's all the questions that we have. So this concludes today's series, and I just want to thank Dr. Weeks and Kendall for joining us today and providing information that is really important. We want to invite you guys back to come to our Spanish session, which is going to be from 1 p.m. to 2:15 p.m. today. And we also would like to invite you back tomorrow and the rest of the week for our English sessions that all begin at 11. So thank you very much, and it's been a pleasure talking with you guys.